Most children squirm when they see a needle coming at them at the pediatrician's office. One mom, who also happens to be a doctor, wanted to come up with a creative way to explain the coronavirus vaccine to children to help ease some of their fears.
Right now the vaccine is not for their age group. However, they're seeing their parents, if they're healthcare workers or essential workers, signing up for it and getting vaccinated, or their grandparents.
Dr. Mary Mason is working with children around the country to help families talk about the COVID vaccine with their children.
The scary thing is the number of people dying. And that's very scary for them to see, or they see someone who looks like their grandparent, in the hospital. So what we also try to do is show them, what is going on.
Mason says if they seem anxious about it, there are many things you can do to help your child cope. One strategy she uses is explaining step by step how the vaccine works in your body, but break it down in ways that are easy to understand.
So what we're trying to do is we show them how the vaccine that the adults are getting is actually causing their cells to create a protein that will actually trigger their immune system to rev up and work.
But she says it's important to start talking about it.
Kids get all sorts of vaccines throughout their life. This vaccine is the same science to create it, to test it, to make sure it's safe.
We are going to have so much fun today.
Through Mason's program, The Little Medical School, children across the country learn about science and how the human body works.
When COVID happened, we really took that opportunity to take the scary things that kids were hearing on the news and to empower them with knowledge and break it down in a way that they could understand it.
Often Mason and the other teachers use show and tell or even props to help get a message across, especially to younger students.
Trying to find different fun games and activities that really shows them the science, behind how vaccines work. And it really puts them in a position where they're empowered. And so when they hear about it, they're not scared.
Mary points out we know children and teens will likely be in the final group to receive the vaccine. Both Pfizer and Moderna recently began new clinical trials that include children as young as 12 years old. A full pediatric vaccine will reportedly be available by late this year.